Hello, everyone. Good morning, good afternoon, and good evening, in whatever part of the world you're watching me from, and at whatever time you're watching this. My name is Dr. Akere Leopemi, and today we are on Health Talks with Dr. Okwe. I'm going to be telling you something very important, and I titled it Four Names You Need to Know When You Go to See Your Healthcare Provider. When you go to see your doctor, for instance, four names you need to know. Now, the first name you need to know is the name of your doctor. Just as your doctor needs to know your name, I'll tell you why shortly. The second name you need to know is the name of your diagnosis, the health condition that you're suspected to maybe have, or the doctor is entertaining as being the reason for your coming. That's to say, maybe you come with a health related complaint. So, the name of your diagnosis. The third name you need to know is the name of your medications, and I'll explain shortly. And the fourth name, I'll leave that for last, and I'll tell you fully about the fourth name soon. So, four names you need to know. You need to know the name of your doctor because I know and I believe that basically enhances the doctor patient relationship. Your doctor should not be someone so far away from you that you cannot relate with and share with the fears, feelings, and other thoughts that are on your mind as it relates to the reason for your being in that consulting session. So now that's one name you need to know, and I'm giving you a little bit of the reason why. You need to know your doctor. It helps the patient-doctor interaction. It enhances it. You begin to see the patient as a person and the doctor also as a person. And that is just a summary of why you need to know your doctor's name. You may want to explain that, oh, I was seen by so and so person a few days ago. This is what he did to me. Or maybe you see him next time on the street. You can relate better with him because you say, oh, this is somebody who I can relate with on a personal human level. The second name that I mentioned you need to know is the name of your diagnosis. I use the word diagnosis in a strict sense, but in a general sense, what is ailing me? What is my challenge? I'm using my. I come to the hospital, you come to the hospital with a particular challenge, and then you want to know what actually does the healthcare professional, the doctor, feel is the issue. We have many names for many diseases now. Maybe an individual comes with a fever, for example, and headaches, and then sore throat. He now comes with the doctor. Doctor, what is the problem? What exactly is my challenge? The doctor says, okay, I feel you have, after listening to you and examining you, pharyngotonsillitis. That's the diagnosis. What does it mean? It's the inflammation of some particular organs at the back of the throat. It's quite common, but it is treatable. So knowing enough of your diagnosis is actually a prelude to knowing more about your health condition. So the second name you need to know is know your diagnosis, or in a broad sense, what the doctor feels is ailing you. Oh, doctor, I'm pregnant and I'm feeling somehow in my abdomen. Oh, it's just the normal fetal movements. That is the name of the condition. Oh, I'm feeling a weight. Maybe it's just the growing pregnancy, and that is the name. So that's an explanation of what actually the healthcare professional, that's the doctor in this case, feels is ailing you. So the second name you need to know is your diagnosis. The third name you need to know is the name of your medications. For instance, if your doctor decides to prescribe certain drugs to you based on your complaint, that okay, these will help you, this will cure you, this will relieve the condition, you need to know the names of what you're taking. And knowing the names of what you're taking is also a prelude to knowing exactly what those things are supposed to do for you. Oh, I'm giving you paracetamol, for example. This will reduce the fever and reduce the headaches and make you feel better. But the major thing I'm giving you is an anti-malarial. Now, this will directly attack the malaria parasites and rid you of the illness. So you need to know the name of the drugs you're taking. Oh, my doctor says I have high blood pressure. I have two drugs, but I don't know their name. That should not be your case. I'm on maybe a particular drug is a blood pressure lowering medication, or this other drug is to help with sleep, and this other drug, the name is, for example, maybe bromazepam or Lexotan as it's commonly known, or this other drug is aspirin. Aspirin is to help to make the blood fluid and to reduce the chances of it clotting, when it shouldn't clot. So the name of your drugs is important. So you don't just swallow medications without knowing exactly what they are called and what they are to use, what they are used for. Those are three names you need to know. Now, the fourth name you need to know is the name of your God. And why do I say so? Because even in our Nigerian context, for example, we say we care, but God heals, and healing comes from God. So you need to know the name of God. And so, without further much talk, I've given you the four names that you need to know when you go for a health consultation. And I look forward to your comments, your feedbacks, your questions. I really love questions. And I look forward to seeing you on my next short clip on the Health Talk with Dr. Pe series. God bless you. Have a good day. Bye.